Welcome to Physiology Bites, everyone. My name is Ben, and today we'll be talking about some basic measures of cardiac function, stroke volume, and cardiac output. Now, when you look at the heart, remember it's a pump. The right side is pumping blood to the lungs, so we can take in oxygen from the air we breathe in, and that oxygenated blood then returns to the left side of the heart, and the left side of the heart, the left ventricle contracts, pumping that oxygenated blood all around the body. And the factors we're going to be talking about today are essentially ways that we can measure or interpret how well the heart is doing that function of pumping blood. So the first thing I'll talk about is stroke volume. So stroke volume is the volume of blood ejected by the contraction of the left ventricle. So if we think about how blood is received by the left side of the heart, it first comes through the left atria, and this is all from the lungs, so it's nice oxygenated blood. It moves from the atria and flows into the ventricle, and it does that because this left AV valve is open. Okay, but then what happens once this ventricle fills with blood, the pressure builds up and it closes that AV valve. And for a while, both of these valves are closed. But then what happens is this left ventricle contracts. And when the ventricle contracts, think of when you squeeze a bottle. When you squeeze a bottle, the pressure inside increases. And if you take off the lid for that bottle, water is going to be squirted out of the top of it. And that's what happens here. The ventricle contracts, the pressure builds up, and it opens this aortic valve here. And what this means is blood will leave the ventricle and enter the aorta, and that's how we get oxygenated blood from our head, from our toe, from this left ventricle ejecting that blood into the aorta. Now, that volume of blood, which moves from the ventricle to the aorta, is the stroke volume. Okay, so that's all stroke volume is, how much blood is ejected by the left ventricle every time the ventricle contracts. But when we measure this, of course, we have to measure this by looking at the volumes within the ventricle, because it's quite hard to track a volume of blood moving through the aorta, for example. So the way we actually measure stroke volume in the heart is by looking at end diastolic volume, and from that we subtract the end systolic volume. Now, diastolic means the end of a relaxation phase of the heart. So when the heart's relaxed, okay, diastolic meaning relaxation, at the end of relaxation, we have this ventricle filled with blood, okay? And this is the most blood which we'll have during the cardiac cycle. Then what's going to happen is that ventricle will contract, expel a certain amount of that blood through the aorta, and that's our stroke volume. But then what's left in the heart is our end systolic volume. And so this is saying the amount of blood left at the end of a ventricular contraction, systole. So we have the amount of blood left before contraction of the ventricle and then after. The difference between these two is our stroke volume. The way to think about this is if you had a glass of water with 100 mils in it, and stroke volume is measured in milliliters, if you drank 50 mils, okay, and then you looked at the glass, you would have 50 mils remaining. Okay, so this is how, when we look at the vessel and how much blood is left in it, we can subtract this end systolic value from our original value here, and the difference between those two is our stroke volume. The thing about stroke volume, though, is it doesn't tell you how frequently the ventricle contracts. It just tells you every time it contracts how much blood it expels. So this is where cardiac output becomes very important. Cardiac output is the amount of blood pumped by the heart in 1 minute. And this is a very useful measure, because if you wanted to measure the effectiveness of a pump, how much of a substance it can pump in a minute is a great way to know how well it's working. And so the way we calculate this is actually very straightforward. All right, cardiac output is simply your stroke volume, which we've talked about, how much blood is ejected by each ventricular contraction on the left side of the heart, times your heart rate. Because your heart rate is simply a cycle of atrial and then ventricular contractions. So every time you have a heartbeat, okay, you have both your ventricles contracting. So if we know our heart rate, or the amount of heartbeats we have going on, we can then calculate how often the ventricles are expelling blood. And we just times that number by our stroke volume. And this is very useful because this gives us a measure of how much oxygenated blood we can distribute around our body. That's stroke volume and cardiac output. Goodbye.